Hi, I wanted to talk today about other options for insurance when you are getting ready to go on Medicare at 65, but your spouse is younger than 65. So this is a problem that many couples face. I would say most couples face. And let's say my husband, for example, I've been on his work plan at work for, years, and now he wants to retire. So he's turning 65, he's made it to the promised land, and he's going on Medicare. What do? So now I can't be on his plan anymore, and I'm only 62. Well, you don't have a lot of options. Your main option would be, well, first you could take Cobra. Cobra's expensive, so I never really talk about Cobra, but that is an option that you could exhaust Cobra. It's expensive, you have to pay all of it, but it might be something you look into. Other than that, you're going to look at the Affordable Care Act, Obamacare, which is not affordable for most people, especially if your husband was working. It's based on your joint income, and if your income's low enough, then you'll get a very good government subsidy, and you might not pay anything for Obamacare, for the Affordable Care Act, or it might be very, very inexpensive. Those people love it, they're very happy. For the rest of the people that have to pay full price for it, not so happy. So you might find that you have to pay $500 a month for your health insurance that you were only paying $100 a month while your husband was working. Oh, I got a question. Rita, I'm on disability. I've been out for 2 years. If I decide to go back to work full time, will my ultimate retirement amount adjust? Yes, I would recommend you look into the Ticket to Work program with Social Security. Don't just quit Social Security disability. Do the Ticket to Work program. That gives you 9 months to keep your disability payment and go back to work, earn as much as you want. It will not reduce your disability payment. And if then you can continue to work, then you can keep your Medicare benefits, which that's all very key. So, if you do go back to work, yes, for everybody that's on Social Security, every year that you work gets indexed, and if that's one of your highest 35 years, that'll replace one of your lower years. So if you go back to work, that could bump up the total amount you get on Social Security when you do decide to draw retirement benefits. So I'm going to go back to talking about health insurance, but if you guys have other questions, pop them up there on the screen. Other health insurance benefits besides Obamacare would be short-term medical. We sell a lot of short-term medical. It's not Obamacare, it's an alternative. It's about half price. So it's something to look at. It doesn't cover pre-existing conditions. So if you're already sick and you're seeing the doctor a lot for something, not a good option. But if you're healthy and you're saying Obamacare is ridiculously expensive, it might be a very good option. The third or fourth, depending on if you look at Cobra, would be health shares, such as Altrua. There's several other ones. We've used Altrua for years, but it's not insurance. It is a loophole in Obamacare that was made as like a religious exemption. It's something to look into, but it is not insurance. We sell a lot of it, but it's my last choice. Rita, thank you so much. I'm happy to get a question on here. People that are on Social Security disability don't understand how it works with Medicare. So that's what I was trying to warn Rita about, is you don't want to lose your Medicare. Don't just be like, ditch this. You can keep your Medicare. If you lose your Social Security disability, but you still have your disabling condition, you can keep your Medicare for up to 8.5 years. It's very generous because the government wants you to try to go back to work. So they want to make an attractive option for you to go back to work, but you can keep your Medicare. And that could bridge you all the way into Medicare at age 65. So you don't want to mess that up and lose that, because unless you're going to get good health insurance at work, you're going to want to keep Medicare. Medicare is less expensive and better insurance than most people realize. The other thing people don't realize is if you have insurance at work, you might not realize how bad it is. If you haven't used it, you don't really know. Then when you have to do a comparison between it and Medicare, you assume, since your employer pays part of it, that it has to be better than Medicare, right? Because you're getting it subsidized. It doesn't mean it's better. Over the past 20 years, insurance at work has gotten stripped down. It used to be fantastic. Now a lot of plans are not fantastic. Michelle, If I work full-time at 67 and sign up for Medicare B, but don't start using Medicare till I retire, where'd my question go? I don't know where it went. Michelle, where'd the question go? Disappeared. Okay, there we go. If I work full-time at 67 and sign up for Medicare B, but don't start using Medicare till I retire at 70, can I still contribute to an HSA? Woo! Okay, no. If you're going to continue to work past 65 and you want to max out your HSA, your employer's contributing, you're contributing, you want to get those tax benefits, you cannot have any other health insurance. And Medicare A is other health insurance. So you would have to call Medicare and decline it if you already signed up for it. And if you mess that up, then you will lose your tax deferred benefits. The other trick with if you have an HSA, and let's say you're 67 now, and now you want to retire and take Medicare, you have to stop all contributions to your HSA, your contribution as well as your employer's, 6 months before you sign up for Medicare. That's because Medicare Part A will be retroactive back 6 months. So if you don't stop the contribution 6 months, you're going to lose that tax advantage and you could be subject to a 15% IRS penalty. So it's a little complicated, but totally doable. And more people are choosing to work past 65 and contribute to their HSA. Now, if you do have an HSA at work, once you do retire, a little known fact is that you can write yourself a check every month to reimburse yourself for Medicare Part B. The average person in 2022 pays $170 for Medicare Part B, so you can just write yourself a check out of those HSA funds. You can Google what you can use those HSA funds for. It's kind of weird you can't pay for your Medicare supplement plan, but you could buy a dental plan. I mean, you can go Google it, but that paying yourself back for Part B is an easy one. Any other questions for the Medicare Mama here? You can check me out on TikTok at Medicare Mama. You can check us out at themedicarefamily.com. And I have a lot of these questions on Social Security, disability, spousal benefits. A lot of your Social Security questions are answered there. And of course, we specialize in Medicare. Terry says, have Medicare A and B? Supplement is Humana. You know, I can't tell you without getting in the computer to tell you if you could get a supplement that might be a better price and might have better extra benefits than what you have. You have to call us at the Medicare Family. We have very robust computer programs that help us compare, and you've got to kind of shop it every year. If you've been on any Medicare supplement more than 3 years, chances are you can save money by moving to another plan, the same plan with another company. That doesn't hold true for every carrier, but in general, that's pretty good advice. Most people don't do that. They just take their rate increases. A Medicare supplement will go up between 5 and 10% a year. And after a couple years, that gets your attention, and then you finally decide to call us. And that's when we finally say, hey, why didn't you call us sooner? So it doesn't hurt to call now. You can change your Medicare supplement plan any time of the year. You don't have to wait till the end of the year. You see all those ads on TV. You can only change your drug plan or your Medicare Advantage plan in October, November, and December. But you can change your Medicare supplement at any time, and you can change it several times a year. I wouldn't. I'm down here in Daytona, and those are the bikes. Let me see if I have another question in my box. I don't know how to get rid of these questions. I'm trying to get Blue Cross next open season for basic. Yes, call us. You don't pay extra to work with us at themedicarefamily.com. It's 1-800-970-1964. We represent all those companies. We can shop it all for you. Tanya, I'm on disability. My last husband and I were married for 12 years. I'm 64. My ex-husband is still working but is 62. When can I make a claim for his Social Security? You can claim on your ex-husband's Social Security when you are at least 62 and he is at least 62. If half of his is more than all of your benefit. Now, you can't have remarried. If he is not drawing Social Security, that doesn't matter. You can go ahead and draw off him anyway. The rule for spouses is different. If I want to draw off my spouse, I have to be 62, he has to be 62, but he has to be drawing Social Security benefits. So if he goes, I want to work 5 more years, then I cannot draw my spousal benefits off of him. I would have to draw my own, even though it's less. And when he finally does go on Social Security, that's when I could switch to my spousal benefit, which would be up to half of his benefit. And I don't know how to make the questions stay up on the screen, but I'm trying here. So if you guys have more questions, you can get a lot of them answered at the MedicareFamily.com. Go to our website, or you can call us. Consultation's always free. We work in all 50 states, and we work with hundreds of insurance plans. Kaiser, Mutual of Omaha, Manhattan Life, AARP, United Healthcare, WellCare, Centene, Humana, Aetna, Cigna, on and on and on and on. So we can give you our opinion on your unique situation, which is very unique to you and the state you're in. The laws vary dramatically from state to state. So when I'm talking to somebody in Illinois, it's going to be very different what's available to somebody in Florida, or somebody in California, somebody in Nevada. Terry, can I draw my survivor benefit at 65 and change to mine at 70? Absolutely. That's one of the best and only strategies that's left in Social Security, is to take your survivor benefit, but let your own work history, your own money, continue to grow and max out at 70. It doesn't grow past 70. There's never an advantage to taking Social Security past 70. That goes for everyone out there. But you could actually switch earlier than 70 if your own work history eclipses what you're getting from your survivor benefit. So that is something that you can talk to Social Security about, and they can tell you what those exact amounts are going to look like. Brian says, no question, but thank you for all you do in helping clarify Social Security. I'm 38, and like many of my generation, have some anxieties. Like your whole generation thinks it's going to be gone. It will be here. It started in 1935. It's changed many times. It will continue to change by the time you become eligible for Social Security. And I hope you don't become eligible until you're at least 62, because if you became eligible earlier, it would be due to disability, which I hope you don't get. But it will be here. It's all clickbait. All these articles and news, they're just trying to get people to stay tuned, but it will be here. It will change. Right now, Social Security only taxes your first $150,000 of income. So if you make $500,000, they're not taxing it. Jeff Bezos is not being taxed for Social Security for all of that. That's an easy lever that they could change to put a lot more money into the Social Security trust fund. They could also raise the age. That's very, very hard to do, but that's something that they could do. There's a lot of changes that will happen, but don't worry about it. You will have Social Security. Terry, a Social Security rep said they don't have that option anymore. I can't take my deceased husband and change to mine. Unfortunately, when you call Social Security, Medicare, the IRS, any government entity, I'm trying to be gentle because they're hardworking people, but you can get a lot of people that are not very good at their job. You were given wrong information. You can take yours and you can take survivor benefits and switch to your own. Just call back again and get somebody that is more knowledgeable, or Google it and you can see that what I told you is in fact true, and that what they told you on the phone was false. They have 1,200 employees. You know, you're going to get some people that don't care, that don't like their job, that aren't very good, that are new and experienced. And I used to get that all the time when I first started training on Medicare, and I'd go to do seminars. I would share the stage with somebody from SHIP, SHIBA, the volunteer organizations, Social Security, and they would give wrong information. And I'm sitting there. I'm a lot younger, so I didn't have the automatic credibility that somebody with gray hair did. And they're saying they're giving out wrong information. The whole crowd turns against me because I'm not on the retirement age, but I was the one that was right. And so I looked bad by calling them out for being wrong, but they were wrong time and time and time again. So Google is your friend. Go in and Google it, and you will see that, yes, you do still have that opportunity. If you guys want to get more information, you can go to our website at themedicarefamily.com. You can join our Facebook group, and you can put questions in there as well. Have a great day.